Hey there, my name is Megan Clanahan. I'm the co-owner of Houston Moms. And every month we bring you a video from our preferred providers, UTMB Health, about topics that you want to know about. And this month we thought it would be super timely after we almost just died in April in the summer. We are talking about seasonal allergies. It feels refreshing to at least talk about allergies. We're not worried about it being other things. But we are going to dive into everything that we should expect from allergy season, how we can help treat it, what do allergies specifically look like outside of the typical runny nose. And with us today, we have our provider, Dr. Jennifer McCracken. She is a board certified doctor down with in League City and in Galveston with UTMB Health. Dr. McCracken, thank you so much for joining us.
Well, thank you so much for the invitation. I'm happy to be here.
Yeah, so tell us a little bit about your background and what you do.
So like you said, I am an allergy doctor. I went through med school and did all of my training here at UTMB. So I like to say that I am very dedicated to the area. That what we do is we see patients who have allergic rhinitis, like everybody's suffering with right now. We take care of patients who have asthma, food allergy, medication allergies. We also take care of a lot of patients who have eczema or skin rashes. And then also we're immunologists. And so we also take care of patients who have recurrent infections because they have problems with their immune system.
Wonderful. And you're also a mom too, right?
That is true. I have 3 kids that keep me busy. So trying to balance being a doctor and taking care of all my wonderful patients, as well as being a mom, keeps me very busy.
Yeah, so I know we love having practitioners on here who are parents because you're in the trenches with us right now and you get it. Whether it's us suffering with the allergies or whether it's our kids. And so let's just go straight into the questions. Let's talk about what are seasonal allergies? What does that even mean?
Yeah, so when we describe people who have seasonal allergies, to us, that means that people are what we would call sensitized to some of these innocuous pollens and things that most people don't have problems with. Over time, people can develop this sensitization to grass pollen, tree pollen, weed pollen. And upon exposure to those during different times of the year, they have these allergy symptoms, which can be things like you mentioned, the runny nose, congestion, or a lot of stuffiness. A lot of people experience like from all of that. Also itchy eyes, watery eyes, sneezing. I think a lot of us are familiar with that postnasal drip, that just annoying tickle in the back of your throat that causes you to do the throat clearing constantly and the cough. So it can really present in a lot of different ways for people.
And we know that we've had a particularly kind of rough season, it feels like. This go around. I feel like April was pretty tough. Talk about that a little bit. It was oak pollen, right? Tree pollen?
Exactly. So those different plant pollens that pollinate during different times of the year cause different symptoms or different seasons to be bothersome for people. And so tree pollen is particularly difficult in the spring. Oak pollen this year was at historic highs. So I think even people who typically aren't bothered by that many allergy symptoms were really suffering this year. So yeah, it's been a really difficult spring due to that pesky oak pollen, all that yellow stuff that was all over everybody's cars and driveways. Fortunately, the levels are going down again. So hopefully people will get some relief soon.
Good. Well, I know it's funny because you mentioned people who don't typically suffer. I do. I'm a seasonal allergy person, but my husband is not. But even he was, going out and doing these workouts and early in the morning, he's like, I can't breathe. And I'm like, you have allergies.
Yeah.
And so are there certain people who are more susceptible to seasonal allergies?
So you're not born with seasonal allergies, but you're definitely born with a predisposition, perhaps. It tends to run in families, as you may notice. People say, oh, my whole family has allergies. And so there is some genetic factors that can make you more likely to develop allergies, but doesn't guarantee that you will. And the people who develop allergies are also a little bit more likely to have asthma or eczema or food allergy, sort of that all goes together.
That's so interesting, because it totally is genetic in my family. My dad had it, and he was allergic to everything. And I tell people I'm allergic to the air. I mean, truly.
Yeah.
And a ton of food allergies. And I know it just seems to kind of be like growing, where there's more of us that are allergic. Is that kind of what you're seeing?
So we are seeing a little bit of that. I think there's more awareness perhaps, or more accessibility to being tested. And then people can say, yes, I am allergic.
Okay.
There's also the thought that what we call the hygiene hypothesis sort of plays a role, that almost we're too clean and our body is starting to react to these normal innocuous things that we shouldn't be reacting to. So I don't think we have a great explanation, but those are some thoughts on why we're seeing more people with more allergy problems lately.
That makes sense. I mean, definitely allergy testing is more accessible now than it was. So what can people do to help mitigate these allergy symptoms? Like if we are talking all of the yuck, I get, swollen and feel like my head's, going to pop off here in my sinuses. What can we do to kind of, help self-treat our allergy symptoms?
Yeah. So when we talk about treating allergies, there's really three approaches that we take. One is try to avoid what you're allergic to. And things like that can be difficult, especially when it's the pollen and you can't really live in this bubble and things. Right. So whether it's checking the pollen counts and just trying to minimize your time outdoors when the pollen counts are really high. If you know you're going to be outside for an extended period of time, coming in and showering when you get inside, changing your clothes can be helpful. Also making sure you keep your car windows closed and your windows in your home closed, running the air conditioning can help, but that's usually not enough for most people. Mm-hmm. And so the other approaches would be medications, or things like allergy shots, which we can come back to. But medications are the easiest and most accessible thing for people to use. Actually, many of our allergy medications are available over the counter. They're very effective. It's what we usually recommend for patients the first time they come in our office, really. So things like the nasal steroid sprays, which are available over the counter. There are multiple different brands and types available. I don't really have a preference of one being better than the other. It's more about using them consistently, which is really the most important thing I want to stress, and making sure you're using really good technique when you spray it. So if you're having nasal allergy symptoms right now, the first thing I would tell you to do is go get a nasal steroid spray at the pharmacy. The other thing is, so I'm coming back to using good technique. I want to mention that because that's the first thing people do wrong. Is with the nasal steroid sprays, always make sure you shake the bottle up really well, below your nose, so it's as clean in there as possible. And then the most important part actually is I want you to put that nozzle in your nose, tilt it a little bit to the outside the bottle, and direct the spray toward the corner of your eye or your ear, followed by a little gentle sniff. A lot of people's natural inclination is to put it in your nose, spray it straight up, and sniff it in. And when you do that, you actually bypass the important part of your nose, which is a little bit more on the outside. You suck it down the back of your throat. And then everybody says, it tastes bad. It's not working. And I would argue it doesn't need to work down here. I need to keep it up in your nose. So if you're at home using a nasal steroid spray and you say, this isn't working for me, try making that little adjustment before you say this stuff doesn't work.
Okay, y'all, that was just the tip of the day because I completely just learned something new. I have used nasal sprays for I don't even know how many years. Nobody has ever told me that.
Yes.
Okay.
I have
changed my world tonight.
Skeptical all the time. They say, I'm already doing this. I don't want to do it again. I say, please just give me a chance, humor me. And they come back and they say, that made all the difference in the world. So just try it.
I think that is such a great tip right there. Let's make sure we're using our medications appropriately and correctly.
Yeah.
Perfect. Okay, so we kind of touched a bit on allergy shots. So let's go back to that.
You want to go back?
Who becomes a candidate for allergy shots? What does that look like?
Sure. So allergy shots are probably the closest thing we have to a cure for allergies. It is by no means a quick fix. It is a time commitment to do something like allergy shots. And so in order to see if someone would be a candidate for allergy shots, we would first have to do the testing. We would have to do either our skin prick testing, which you would do in a clinic visit when you come to see us, or we can do it with a blood test. And after we confirm that your nasal symptoms truly are due to allergies, then we can start the allergy shots. So basically, people who qualify for allergy shots are generally people who don't do well on the medications or have not gotten enough relief with the medications alone. For those that aren't really able to tolerate the medications, or really, I would argue, anybody who has positive allergy tests and is looking for a more long-term solution and the need for less medications over time is really a good candidate for doing allergy shots.
Okay, and so you brought up the testing portion, the skin prick versus blood test.
Yeah.
Can you kind of speak to how accurate both of those are? Does it tend to, is one better than the other, or they're both adequate?
So they're both good. I will tell you that I do tend to prefer to skin prick patients, especially if they're interested in allergy testing, or excuse me, allergy shots. And the reason for that is there's a little bit more thought that it's perhaps a little more clinically relevant. So positives really mean you're really suffering from that allergy rather than a false positive per se. And so when we do the allergy testing in our clinic, we test for 50 of the most common environmental allergens in our area. So that includes things like the trees, weeds, grasses, molds, cat, dog, dust mite, and cockroach. So a combination of indoor and outdoor allergens. You can either prick you on your back, or we prick you on your forearms. We sit there for about 15 minutes while it does its thing. And then when the test is complete, if you're allergic to something, those places will look and feel like mosquito bites. Yeah. And so I say it's not a painful test, but it can be quite uncomfortable if you're allergic to a lot of things, because you'll be sitting there itching and scratching and things.
Yeah, all of your histamines are going, right?
All those activating all those allergy cells in the areas that we poked. So in order for us to skin prick people in clinic, you have to stop your allergy medicines, particularly the allergy pills. And that can be difficult for a lot of people, especially now where they're really struggling.
Yeah.
So in some cases like that, we may choose to do blood tests if they're unable to stop their medications, for other reasons that we don't want to skin test.
Gotcha. So maybe time it where you might know it's a lower allergy season for you. So maybe April would be the time to do all of the skin pricks. And so, so obviously a lot of the people watching suffer from allergies like I do, but they also have kids who suffer from allergies. So can we speak a little bit to allergies and kids and what that looks like and treatment for them specifically?
Sure. So really, it doesn't look that much different in kids than it does in adults. They have a lot of the same runny nose, itchy eyes, cough that we do. A lot of the medications that we use to treat adults, like the nasal steroid sprays, most of them are approved to the age of 2. So you can start those young if the kid is cooperative and will let you do it. I think that's usually the biggest struggle, is to get them to sit still for the nose spray.
Right.
Most kids don't start showing signs of allergies until the age of 2, really is. So like I mentioned, you have to become sensitized to these allergens over time, and it takes a couple years for that to happen. So if your kid is having the runny nose and they're 8 months old, it is probably less likely allergies causing that rather than some other reason. We all call these runny nose, sneezy, congestion allergies, but there's actually a lot of reasons why people can have nasal symptoms besides true allergies.
Really? What would that be?
So things like irritants in the air, our nose, it acts like a filter. So we're breathing in dirt and dust and particles all day long. It lands on that nasal mucosa in there, which itself can cause some swelling and some secretions without it being truly allergic in that true sense of the word.
Okay.
Medications can actually cause nasal symptoms. As people get older, the nerves that activate the mucus glands in their nose don't respond quite as well or work quite as well, so it just drips. And so there's several, like I said, several different reasons why people can have allergies.
Okay, that's so interesting.
Our job, we try to figure out which is the real reason, because sometimes treatments can differ a little bit.
Oh, for sure. So if you have a mom or you just have a patient who is like, I am suffering, what is your best recommendation for their next steps? Who should they talk to initially, and then what happens after that?
Yeah, so if you're really suffering with allergy symptoms, like I said, the first thing that I would say, like I mentioned, was go to the store, get your nasal steroid. You're doing all that. You've tried maybe some of the oral antihistamines that are available over the counter. All of those are good options as well. Nasal sinus rinses. If people are not opposed to that, I feel like people either love those or hate those, but like the Neti Pot or the NeilMed sinus rinse, those really clean out a lot of drainage, clean off all that dirt and dust and pollen that's accumulated in your nose. But otherwise, see your primary care doctor if you have to. They can sometimes prescribe some of the allergy medicines that are not available over the counter. Otherwise, come and see us. We're more than happy to talk to you about some of these alternative options. Unfortunately, there aren't any really super quick fixes for allergies. I think everybody comes in wanting steroid shots and things like that. But I'm going to be honest, that's not our favorite way to treat allergy symptoms. There's more effective, better long-term options. I understand people are really struggling in the moment, but some of the nasal spray therapies and other things that we can do are better approaches.
I think that's great advice. And every time we have one of these videos, our biggest thing that we always say is you have to talk to your primary care physician. They have to kind of know what's going on, so then they can be like, Matt, maybe it's time for us to move on to like a more specific practice, like, you know, an allergist, and get some of these things figured out, because I can tell you allergies for sure can take you down. And you feel bad saying like, I have to cancel this meeting because I can't breathe, but truly like it can be really impact your life.
No, that's one of my favorite things about being an allergist, is that some of these just little things that I've sort of mentioned about the interventions that we can make such a huge difference in patients' quality of life, that they say, you know, I can go outside and watch my kid's soccer game, or I can do whatever. I can have my cat in my lap again, or whatever it may be. And they just come in smiling because they feel so much better.
How really rewarding is that? I mean, because I truly think if you're an allergy sufferer, you know how much it does impact that daily quality of life. And you don't know from day to day if you're going to wake up and it's going to be a good day or a bad day. It's just a big surprise, right?
Yeah. I mean, sometimes we can predict based on season, like we said, but otherwise there's different things. Yeah.
Oh, and I mean, when that wind starts blowing, because we're all experiencing that high wind right now too. So Houston allergy sufferers, take heart. There are solutions. We've talked a lot about the nasal sprays, the different over-the-counter medication, and then knowing that there are specialists like Dr. McCracken down in League City and Galveston who can help you. And of course, across all of the UTMB Health channels, and who can help, you know, kind of grab that quality of life back. Dr. McCracken, I know we covered a lot today. Was there anything else that you would like to share?
Yeah, I would just say, if you are struggling, like you mentioned, and really want some easy solutions, come find us in your allergy clinic. I mean, we see patients who are dealing with this every day, and that's what we love to see. So don't be afraid that we're going to think, oh, it's just allergies. It's not that big of a deal. It really is. Like, please come and see us. We can help you so much.
I think that's so important because a lot of times we feel like we're kind of going crazy because that's not something we can really, be like, oh, it's for sure this. We just know we're miserable. And so we need people who understand that. And it sounds like you very much do, which is so appreciated. And we are going to drop the link for the allergy clinic down in the comments below, as well as we always find a provider. If you don't have a great primary care physician, please make sure you check out UTMB Health and find that primary care physician, because it is so, so important to just your general overall health. And then that way you can get to the specialist too when you need it. Dr. McCracken, thank you so much for taking the time to join us today. I appreciate it.
Absolutely. Thank you so much for having me.
Yeah. And until next month, Houston moms, we will see you back here around the same time. We'll bring you another hot topic. But until then, we encourage you to keep checking out the videos from UTMB Health. We will direct you towards a post in case you've missed any of ours from either 2022 or last year. We did one every single month. There's so many great topics out there that we have covered, and would love for you to dive into those as well. But we will see you here next time. Thank you so much to UTMB Health, and y'all have a great day.